One more. So we have Rochelle here. What do you want to look at today? What's some of your spots?
I noticed also, she brought it out to me that one of my shoulders is higher than the other.
Okay, you mean your daughter?
Yeah.
Showed it to you.
She noticed
yeah.
It. And then when I looked in the mirror, I said, yeah, she's right.
So turn this way. And so your left shoulder is a little higher. And what I'm looking at is just these two slopes or these angles here. And this one feels higher.
Right.
A lot of people have these imbalances, and sometimes you go your whole life, you don't notice it. But sometimes when you start to get symptoms, like you think, oh gosh, my shoulders are achy. Then you look in the mirror, or your daughter or friend says, oh yeah, your shoulder's higher on one side. So sometimes that's fixable. Sometimes people just always have that. For me, what I'm more concerned about rather than having one side not match, because humans are very asymmetrical. For example, our nostrils are different sizes and my palms are different sizes. And we just don't match. Well, we even have organs different, like your liver is on the right side. We don't have a liver on the left. We have 3 lobes in our lung on one side and 2 on the other. So our bodies don't match. And if we cut your body, we're not going to do this, but if we cut it straight down the middle and we weighed both halves, like the left half to the right half, they would not weigh the same. So we don't even have that matching. But my biggest concern more than matching is functionality and pain. So if you go, yeah, you know, I notice my shoulders don't match, but I never have pain, I'm pretty happy for that person. But if your shoulders don't match and you have, you know, constant tension, pain, you don't sleep well, you're not happy with it, then I do care.
I have exactly that.
You have those things.
I have a little
so you have this stuff. Keep going. Neck, shoulder.
My neck is always strained. Sometimes I wake up in the morning and it hurts, and then it causes a headache.
All right, so you get headaches
I don't know if it's something to do with the pillow or it's causing my neck is not in alignment right.
All right.
And I also don't sleep well through the night. I wake up in the middle of the night a few times.
All right.
I also have a lot of tension in both shoulder blades.
Okay, so you got neck, upper shoulders. How's the lower back?
No pain at all.
Okay,
it's fine.
So
I have a torn meniscus on my left knee. I'll just bring that out.
And has your knee become an issue? Like, do you limp? Do you have trouble getting around?
No, I limped when I first started because it was swollen. I went to the doctor. He said I have osteoarthritis, and for that reason, I should not have it surgery. I should just do physical therapy.
All right, let's get you. We're not going to do your knee today. Okay, I mean, you know, that's not what you came in for either. But it's good to know that you told me about it. I'm going to have you. You don't have to pole vault onto this table, but we're going to start getting you on the table now. Put your nose straight down. So we're getting her on the table. I just asked her to take off her top sweatshirt, and she did. So now she's ready. I'm going to have you scoot down towards me a little bit. And because her neck and her upper back is her main concern, that's what we're going to focus on for this session. Bring your arms back alongside your body. I'm going to raise the table so it's easier on me, actually, so I can have a better angles to work with you. And even come back a little bit more. Come back another inch or two. So the thing that I'm going to do first, I'm going to do a few different things, but I'm not going to do like a classic activator technique or a classic anything. I'm just going to see what your body wants to show me.
It just reminded me of something. Like, I measured myself against my daughter, and I used to be 5'2", and I shrunk. I think I'm 5'1" now. Okay.
So she was saying her overall height changes, and that's part of being human. What happens is that, you know, we have discs between almost every vertebra, right? And so we have these bones. We have 7 in our neck, 12 in our thoracic spine, 5 in our back. But when you're young, when you're, you know, 15 to 30 years old, if you take all those discs out and you stack them up on each other, you're talking about, depending on the height of the person, but you're talking about probably 5 to 7 inches of height of our spinal column is made up of disc. So if those discs get thinner as we get older, they lose a lot of they're not as water filled and they start to lose their height. They get thinner and older, which we do too, including myself because I'm in my 50s. You will lose overall height in your entire spine, much less because of the bone, mostly because the discs have lost their thickness.
She asked me, and I had a bone density test, and it was fine.
So it's the disc height that we lose most of our, and if you add all those discs together, let's say you lose, you know, a couple of millimeters on each disc, which is very small, But all of that added together starts to lose overall height. And you think you might have lost an inch. That's possible. A lot of people can drop 2 inches in their lifetime.
Is there a way to fix it?
Yeah, get younger. Turn your face to the right.
Saying okay, stretching your back.
Saying that's not going to happen. Unless we discover the fountain of youth for real, right? So when you turn your face to the right, what happens? Do you feel tightness in the shoulder blade, the neck?
The neck.
Okay, point to it.
Okay.
Point to one spot. Dig your finger into one spot. Okay, right there. Okay, head back to center. Now I'm going to hold that spot, okay? And flopping your hair out of the way. Now turn, as you turn, I'm going to hold this spot. So turn. Do you feel like it's grabbing under my finger?
Yeah.
It's like hurts, right?
Yeah.
Good. Back to center. Not good that it hurts, but good that I found something, okay? I'm not happy that it hurts. But I'm going to adjust into those spots here. Now turn your face to the right and see if it's starting to change at all.
Yeah.
Yeah, what?
It's a little looser.
A little looser. Good. Back to center. Now, someone that's had a stiffness in her neck for how many years?
At least 5 years.
At least 5 years. I had a professor once, and I've heard many people say this, so this professor doesn't even get credit for it, but he said for every year that you've had dysfunction in the body, it could take up to a month once you decide to rehabilitate it. If you're lucky, if that even works. But the way that formula, and I don't even know if that formula is true, but the important part of that formula is that it's telling us that it takes time. Rome wasn't built in a day. So if you decided to take a 5-year issue of like your neck being tight for 5 years, you can't do it in a day. According to that formula that professor used to use, it would be 1 month for every year. So that would be a 5-month project to get your neck back to where at least you feel like it should be for this age and at this point of your life. So does it take 5 months? I don't know. You might be able to do it in 6 weeks or 8 weeks, but you're definitely not going to do it in one day. And, if someone says, oh, my neck's been tight since last Tuesday, that could be one treatment. But if it says my neck's been tight for 5 years, that could be a couple of months of working on it. And I don't mean in my office. I mean yoga, stretching, swimming, whatever is your thing to start to rehabilitate your body. You would do every bit of it with the goal of really creating freedom in the motion of the neck, the way the neck moves. Turn your face to the right now. See if we're getting closer.
Yeah, feels looser.
Looser, where do you still feel it now? So zero in with one finger. Push your finger in there. Reach this hand up and go right here. So you're still pointing there. So back to center. Let me get a couple of more spots. And I'm just digging in here and digging in here. And turn your face to the right again. How about now?
Yeah, it's looser, but I still feel...
Okay, so now turn your face to the left.
This way?
Yeah, how's that turn?
It's tight.
Worse that way, right?
Yeah.
Good, back to center. I'm going to do a couple of more spots. So my goal for someone like you that comes in the first time and their neck is really tight, really super tight, would be that every time you come in, we see like a 5% change. Now, that's a pretty lofty goal, believe it or not, but I probably could do that with you. First of all, you don't have any like horrible injury in there. You just have a lot of wear and tear. And you're also pretty fit and you like to exercise. And so I have that all as in the plus column for you, right?
Yes.
But you'd have to chip away at it. That would have to be a goal for you. And you would have to do some visits with me, but you'd also have to pursue stretching. Lie on your back. Let's go to some other stuff. But do I really think like one visit and you'll be like, I'm 90% better, yay. Don't think so. Here, scoot all the way to the top of the table. But I also think that if you took some time, you could really change this.
But what causes that, let's say?
Tight
neck.
Being out of shape, inactivity, aging, poor diet. There's a gazillion reasons. Looking into computer too much, texting, all these things. And aging. Did I mention that? I mentioned it twice because as we get older, it's so much harder to stay limber, so much harder to stay fit. I had this stand-up comedian friend that said when he was 20 years old, he could work out 10 minutes a day or do a few push-ups and he felt like he had a pretty good physique. Now he works out 2 hours a day to be in bad shape. And it's kind of true. I don't remember how he set up that joke, but it's true. Like as you're in your 50s or 60s, you could work out a lot and you still don't feel as fit as you did when you were hardly working out in your 20s and you look good all the time. So I found a spot here I'm going to adjust, okay? Yeah. So take a deep breath in and relax. Good. One more. And relax. One more. You okay? Take a breath. How you doing?
Good. I'm happy. I'm happy it cracked.
All right. Good. So move closer to me. Yeah, just slide closer. Good. I'm going to reach under you, okay? I just want to do one spot in the middle. Does that hurt your shoulders or is that okay?
No, I can do it.
All right. So I'm just going to do one spot. Maybe this one. There you go.
Correct.
Good.
Wow.
So come sit up now.
To reach area, yeah.
Yeah, it's hard to get.
Wow.
There you go. Move your neck around. See how it feels.
A little better. Still a little stiff.
All right. Open your eyes so I know your eyes are open. Are you all right?
Yeah.
All right. Nice to see you today.
Nice to see you.